I'd like to ask the Minister for Health and Social Care what progress has been made with improving access to NHS dentistry services, and if he will make a statement.
Mr Ashford to reply.
Thank you, Mr President. The Department monitors access for dental patients by maintaining information in relation to the number of unique patients seen at each NHS dental practice over a 2-year period. The Department also retains a waiting list for patients who have been unable to access an NHS dentist. Those patients are allocated to a dentist by the Department as soon as it is able to do so. Useful patient information on how to be allocated to an NHS dentist is available to patients online via the Department's website. There are currently 217 patients on the waiting list as of the 14th of October, with the majority having joined the waiting list just 1 month ago. There is a steady flow of patients being put onto the waiting list and being allocated to a dentist. Patients do often give preferences for particular dental practices, which of course takes longer to allocate if there is no available capacity at the patient's preferred dental practice. The Department has recently consolidated waiting lists held individually at NHS dental practices with its own waiting list. NHS dental providers have been asked to cease holding their own waiting lists to ensure that a true figure for patients waiting for an NHS place can be continually monitored. Since January 2019, I can confirm that over 800 patients have been on the waiting list and have been allocated an NHS place, and dental providers have been asked very recently if they could consider taking on more patients. It is encouraged that NHS practices regularly cleanse their patient lists to ensure that any capacity is recognised and places taken by patients who have been waiting, and to ensure that optimum access is reached.
Supplementary, Mr Hooper.
Thank you very much, Mr President. That felt more like a statement of the current situation. That wasn't really an update on anything that's changed. I first asked about this back in February 2018. That was 20 months ago, and it seems like little, if no, progress has been made at all reforming the way that our dentistry services work. Can the Minister please confirm the number of unique patients that have been seen by dentists on the Isle of Man, and specifically in the north of the Isle of Man, this year?
Minister to reply.
Thank you very much, Mr President. In terms of first of all, the north of the island, in terms of the number actually physically seen, I don't have, but what I can give I will get that for the Honourable Member, and I will write out with that figure. But in terms of what I can tell him is, in terms of someone waiting on the Department's waiting list, when it comes to the north of the island, the longest patient waiting has been September in terms of the waiting list. So I can confirm that to him, but I will write out to him with the number of patients physically seen. And in terms of what I just heard the heckle from Mr Speaker, what year? It's this year. In terms of what's changed, the dental strategy obviously sets out the 5-year direction for the Department. I assume what the Honourable Member is getting at is the dental contracts, which we've spoken about before. They are still being worked up. The plan was for them to come into force in April next year. I haven't been told any different that that's going to change, but I will check. And I have said many times in this Honourable Court, and my position has not changed, that currently what we are doing is we are incentivising treatment, and what we need to get to is incentivising prevention, because, to quote the old phrase, prevention is better than cure.